So I wanted to spend just a couple minutes before we got into the skills training and the workshopping, just talking about a little bit of context for the Medicare for All campaign. Specifically, why is DSA fighting for Medicare for All? And I think, and also, what is the Medicare for All that DSA is fighting for? So Medicare for All, broadly speaking, is the Medicare, taking the Medicare program, improving it and expanding it to cover everyone from birth till death. Well, prenatal till death. DSA has defined this by 5 core principles, which are really crucial to the overall national fight for Medicare for All. Those 5 principles are a single health program, so one program that covers everyone. This eliminates the current situation we have, which is like a tiered healthcare system where some people get some kind of care and some people get no care and some people get a totally different kind of care. And that's really important that everyone is brought together under this one system because it's unifying and it ensures that people are getting a similar level. So one thing that's really important is that there have been a number of studies done that have looked at different universal healthcare programs in other countries. And there's many different models for how to do it. And I'm by no means an expert like on any level in those different models and how they play out. But one thing that has been shown again and again and again is that the more that you introduce the private market into the healthcare system, the higher the discrepancies get in health outcomes and well-being, physical well-being. So even when you have universal healthcare, there are models that like allow more private enterprise into the healthcare system, and you see that kind of directly correlate with worse health outcomes. So how do we stop the private market from like weaseling into it? Well, that's an ongoing, that will be an ongoing process. So we can pass a Medicare for All bill, but we will inevitably have to keep fighting to like shore that up and close in loopholes. And that will just be an ongoing process that we'll have to kind of be aware of. And that brings up another really good point, which is sometimes we talk, rather than talking about Medicare for All, we kind of talk about health justice. And health justice being this idea that everyone, no matter your circumstances, should be not just have access to the same care, but also should achieve the same health outcomes. Well, I mean, obviously people have different physical situations, but should have access to the same health outcomes. And that's kind of like a bigger, broader fight that extends beyond the policy fight of let's win Medicare for All, let's pass this bill. So the second principle is that it's comprehensive coverage. So it covers everything that a healthcare professional can provide. So reproductive health, medical devices, long-term care, dental, drugs, anything that can be provided by a medical professional will be covered under this Medicare for All bill. The third principle is that it covers all US residents, so not just people who have citizenship. So this is a really important point too, that we are asking for a bill that covers everyone that lives in this country, not just people who have citizenship. And then the fourth is that we want funding within the bill to provide job training and job placement for anyone whose job is displaced by the transition to Medicare for All. Because there will be some people who, currently maybe they do administrative work for an insurance company, and this comes up a lot when you talk to folks because it's something that people are concerned about. So being able to state clearly that we are fighting for a Medicare for All bill that accounts for that is super, super important. Yeah.
Is there any talk of trying to tie that jobs program to the Green New Deal?
That's a really good question.
I mean, just like that is a massive jobs program and a lot of those skills will directly transfer.
Yeah.
Speaking of someone who used to work in healthcare and then started working in energy.
Yeah. That's a great question. I don't happen to know the answer, but I'd be curious if anyone else here happens to know how those things.
I don't think they've been talking about. They
Yeah.
haven't linked the two, because I've heard a lot less talk about Medicare For All recently, especially by the new presidential candidates. I hadn't heard them talking about it very much at all.
Yeah.
So I'm a little concerned that it's falling off. So.
Yeah. Yeah, I think it should definitely, those are two very similar conversations. And I think that we should be kind of like working to build those, build those core principles across different like types of conversations. And then the fifth principle is that it should be free at the point of service. So no premiums, no deductibles, no copays. And again, this is supported by the research that has been done. When they look at how implementing copays or implementing higher premiums affects how people access care, it's a pretty clear one-to-one. Like if you have to pay $40 just to see the doctor, you're gonna be like, maybe I'll just wait this out and see how it goes. Yeah.
I'm sorry.
No.
I know you already said this, but I just want it reiterated in my mind.
Yeah.
So, and it's everything, anything a healthcare professional does is what we're going to cover. And that also will include not only preventive medicine, but pharmaceutical products, correct?
Right. Pharmaceutical products definitely would be included. So when we look around at our current healthcare system and we think about these 5 principles, it can seem, it is like a very wide gulf. And it's really hard to see like how we can bridge that gulf. So I think a really important component of this campaign is just like helping people see across that gulf. Because otherwise it can seem just totally impossible. Like I have so many conversations in my just day-to-day life with people who are like, well, yeah, it'd be great if we had universal health care, but that's never gonna happen. So being able to say, I think it can. And I think this is how we can win it is, I think that conversation can be a real game changer for people because it really starts to open your mind about like, what else can we win? Like if we can have this, what else can we have? So that's one reason that the DSA has chosen to prioritize Medicare for All to my mind. And I will take a step back and talk about that. So at the 2017 National DSA Convention, they voted on 3 priorities for the coming 2 years. And they'll vote on 3 priorities in this coming convention too. So every 2 years, they vote on 3 priorities to cover. And so in 2017, they voted on Medicare for All, electoral work, and labor organizing. So when I say why has DSA chosen to prioritize this, that's what I'm referring to. So additionally, why is it important that DSA fight for Medicare for All? It's really important because we're not the only people fighting for it, but we are the ones who have a clear ideological backing and these 5 core, easy to understand principles that are our red lines in the sand. So we can really be a voice in this fight that says like, no, we will not accept a public option. We will not accept, any other like technocratic, wonky ACA version of like healthcare, universal healthcare. We want Medicare for All, and we want it to look like this. So being that clear, strong voice about what exactly that means is hugely important because the program is very popular. It has incredible support. Something like 70% of Democrats say they want Medicare for All, and more than 50% of Republicans say they want Medicare for All. So it's wildly popular. And that you already can kind of see that popularity being co-opted by politicians who, want to get elected on these issues that people are concerned about, but don't actually want to like butt heads with insurance companies and drug companies.
Well, that's their donors.
Yeah. Exactly. So we have to have these clear lines in the sand. And additionally, we are now kind of reaching this very historic moment in the fight for Medicare for All. For the first time in history, there will be congressional hearings to discuss Medicare for All. And so that's huge, and that's really, truly historic. We have a record number of co-sponsors on the Medicare for All bill. And additionally, we have a legit Medicare for All bill. So the representative from Washington State, Pramila Jayapal, she's going to be introducing the Medicare for All Act of 2019, which is a real Medicare for All bill that could be voted on in the House in 2019. And that's going to happen in early February. So there's this real opportunity for DSA to play an instrumental role in building on-the-ground support for a national campaign. That would be a huge win. That would be the first universal social program in the history of the United States, like ever, and would transfer huge amounts of wealth from private industry to a public good. So this is really truly like a historic moment in this fight. And Allison's going to talk a little more about like the role of the Healthcare Committee and what work we've already done. But I guess I just wanted to say to that topic, we've spent a lot of time like growing this committee and growing the work that we've done and getting like, and we have, miles and miles to go, but we've spent a lot of time like growing the work that we've done. And now is the time to like really kick it up a notch, because now we have like something very concrete in sight that we can really work towards. But even as we do that, it's very important that we like retain the things that have made our campaign strong so far, which is a more like looseness and like something like slightly less concrete, where we're really building it on just like conversations with one another and the work in the health fairs and the campuses, which Alice is going to talk a little bit more about. And then the last thing I just want to say is that right now, the National DSA Medicare for All campaign, it's really it is very heavily concentrated in some like big city chapters. And so when I talk to a lot of smaller chapters in this region, a lot of times there's a lot of hesitancy on like, how can I get involved with this fight? Or like, how can we really do something here? Like, we don't have a single payer bill that they're voting on in the state legislature. We don't have a candidate that's running on single payer. And I think that the New Orleans chapter has a really important like kind of leadership role to take on of like, here's how you can do it with just a few people and really still have an incredible, I guess I'm biased, but an incredible Medicare for All program.